we'll talk about a topic which is a very common scenario with which patients come to the ENT surgeons, especially the children age group, that is the tonsillitis. So today we'll know about what is it, how does it happen, what to do with it. Okay, the first part of it, what I wanted to talk is, what is tonsillitis? Tonsils are normal structures which are present in every human, and they are situated at the entrance of your back of the mouth. They are situated in your back part of the oral cavity, in your throat especially, and they are normal structures. And they are there as a first line of defense for us. So when in a growing age, when we are exposed to a lot of microorganisms, polluted air, whatever, take different kinds of foods and waters. So they are there as a watchman or a first line of defense to give certain immunity to the body. But in some people, these structures itself become infected. And the infection or inflammation to this tonsil structure is called as tonsillitis. The main symptoms of tonsillitis can be pain in the throat, itchy throat, pain while swallowing, sometimes pain into the ears when we swallow, dryness in our throat. Extended symptoms could be patients can have fever, neck pain, swelling in the throat, swelling in the neck. In the children of age group between 5 and 15, every child must have had at least one episode of tonsillitis. And this tonsillitis is caused usually due to microorganisms like bacteria and virus. Bacteria mainly Streptococcus family, and viruses, different kind of viruses, adenovirus, rhinovirus, etc. And these viruses and bacteria infect us usually from contamination. Some person with the infection uses a plate or a spoon or a water bottle, and the other person also uses the same. So that is how this infection spreads from one person to the other. Or you exposed yourself into a crowded environment, or children, especially when they're playing a lot of outside, and they contract these infections from each other. Children are actually more vulnerable to this because at that age group, when they are exposed to schools, daycares, playgrounds, tuitions, or crowded places, at that age group, their immune system is not mature enough to handle all the kinds of microorganisms which they are encountered to. So, these children age group are more vulnerable to develop this tonsillitis when we are talking about the children. In the adult age group also, certain set of people have a tendency to develop recurrent or more severe infections, especially adults with other associated diseases like immunosuppression, HIV, which we call it as AIDS in normal terms, or tuberculosis, or leukemias, different types of leukemias, and anemia. So these are the conditions in the adult population where, as such, the immunity in the body is low. So such patients have a tendency to develop severe bouts of infection or recurrent infections when we talk about the adults. So how do we diagnose this tonsillitis condition? So diagnosing tonsillitis doesn't require any specialized tests. That is what I want to emphasize. It is a clinical diagnosis. So what do you mean by clinical diagnosis? So we come to a conclusion of this tonsillitis based on that this depends on the history, the symptomatology the patient gives us, and the examination findings or the clinician who sees certain signs of this infection in the patient's throat. That is how we usually come to a conclusion that this is a case of tonsillitis. If you are having severe pain in the throat, or this is a recurrent complaint for you, every time you go out, have a cool ice cream or have a chilled drink, travel to a cold place and come out, have a recent travel outside your city in like an AC compartment or an AC bus, or there's a change in water, change in food, you start developing sore throat, that means you are having a chronic kind of problem. That is one scenario where you should consult your doctor and understand in what stage it is. Another scenario is in children group, it is a recurrent event. You're getting these kinds of sore throat episodes, pain in the throat, pain while swallowing for about 3 to 4 episodes per year, definitely you should ask your ENT surgeon or a pediatrician or a primary care physician. See, is the patient having a chronic tonsillitis? And another indication where the patients should subject themselves to go seeing the doctor is ask the attender, or in case if it's children, the parents, is the baby snoring at night? If the patient has a chronic snorer, then that is another scenario where we should definitely get attention regarding the tonsils. For a case of tonsillitis, the proper treatment would be based on the clinical findings. The treating physician would decide whether this patient would require a course of antibiotics or not. So based on the clinical findings and taking the symptomatology into consideration, like the pain, fever, or sore throat features, cough, or any other associated symptoms, the primary physician or the treating ENT surgeon or pediatrician in the case of children would like to give a course of antibiotics or the symptomatic medicines for that case of tonsillitis. If the patient is experiencing the tonsillitis episode, then patient should take adequate rest as much as possible, drink lots of water to keep themselves hydrated so that the body gets strength to fight the infection, and take medium to hot liquids like coffee, tea, soups, and also lots and lots of fruits. The most important thing I would suggest for tonsillitis is take warm saline gargles. Put your throat backwards up like this. Take warm saline into your mouth. Gargle it thoroughly till you feel it here and then spit it out. So this way, one can get a lot of symptom relief if they are experiencing the tonsillitis. We can prevent it by maintaining certain hygiene principles, not using the plates or spoons or water bottles or handkerchiefs used by some other people, and washing your hands before eating food, and not coughing outside, keeping your hand and mouth covered while you're coughing, avoiding yourself into the crowded places for a very long time, maintaining certain social distance.